We are here today to discuss and explore some of the conservative treatment that could be really useful for those that have been on ketamine, have got ketamine bladder, that have now abstained but are still experiencing symptoms. My name is Louise Field, and we are joined here today with Caroline Pickett, who is one of the Adore Your Floor team, who works within a rehab centre with movement once a week. We also have the lovely Finn Worthington, who has used ketamine, has now transformed his life, is working within the community, offering online and in-face support groups, and also raising awareness on the TV, podcasts and media. And then we have Michelle Cockram, who is a specialist pelvic health physio, who is a clinical lead within the NHS. This all came about because it's not just my professional experience that has brought this forward. It's also personal experience. There's a loved one that had a UTI and was given antibiotics. And within 24 hours, we were back in A&E, and that was when ketamine bladder was diagnosed. I knew nothing about ketamine bladder, didn't even know it was a thing. And that was a big learning experience for me. We had subsequent weeks of going back to A&E where bladder scans were done, meds were given, but we wasn't given any other kind of guidance. And the ironic thing is that when you're coming off ketamine, the pain that is experienced is phenomenal. And I'm sure that Finn will be able to explain that a little bit more as well when he shares his story with us. And it's only ketamine that seems to help deal with that pain. Once giving up ketamine, there's still symptoms going on. And in the field that I'm working with, bladder and bowels and pelvic floor health, we know that within the general population, conservative treatment proves amazing results. It has evidence to back it up. I'm just not seeing that filtered down to the population that have given up ketamine but experiencing symptoms. And I really want us to explore that and see what we can do about this. Since recently, I've been speaking to ex-users that are also having a broader impact of other symptoms, secondary, such as rectal prolapse, vaginal prolapse, vulvodynia, and some more symptoms, which again, we can explore at a later date maybe. So this project basically is saying, can we do better? And can we explore conservative treatment for abstainers and offer them hope, dignity and practical advice? I believe we can, and I'm committed to doing that. So Finn, without further ado, over to you, my darling. Thank you so much for the work you're doing. It's incredible, and I really appreciate your time with us today. Can you briefly outline some of the work that you're doing with regards to the target group that you're working with and why this is such a worrying problem within the UK?
Yeah, of course. Thank you for having me on, and appreciate it, Louise. So we do work like Louise said within communities. We're up and down the country. We're in schools and colleges and prisons and universities. We work with staff, and we've done all kinds of different things. And we try and help wherever we can. Is the top and bottom of it. Now, if you look at the age range that we're seeing, it's predominantly, I'd say, 17 to 24 is the biggest sort of bracket we're seeing. You do have quite a lot of older people, which, in all fairness to them, not a lot of people give them the recognition. I think most people are looking at the younger generation, and I think naturally that's what we do. I think people feel more empathy for younger people, and I think that's just a natural instinct. But I am very aware that, excuse me, we've had people in our groups at 45, 50-year-old who were in the same position as a 17-year-old. Obviously, it hits harder when you're looking at 17-year-olds, or even, we can take 5 years off that, really, if I'm being realistic. So age range, yeah, it is predominantly, 17 to 24, 25, but there's younger and there's older too. And the reason it's heartbreaking. It's really, really heartbreaking when you speak, especially the younger ones. I've had personal experience with 13-year-olds in schools who are taking it, don't have the first idea of what can come from taking it in terms of the effects, physical, mental, emotional. They just don't understand it, and to them, it's just kind of it's almost like a game. It's just something they're doing. You know, it's like going for a kickabout. I think that's how they see it. You know, so one of our sort of goals is education. You know, and we do that by, like you say, going into schools and trying to hit the younger generation, so that for those that haven't yet been sort of exposed to it, when they do, hopefully they say no, or at least if they don't say no, they're making an informed decision. You know, they know what risk is involved, and that then is their choice. So that's kind of what we're doing. You know, we've got a few different goals for different parts of the community, and we're doing all sorts of stuff. But for me personally, the main one is prevention, because if we don't prevent people from using it, you can rehabilitate people and you can do that forever and ever. But if the prevention's not in place, the problem never goes away. You know, so as much as the intervention and rehabilitation is crucial, prevention's just as if not more important. So that's a little breakdown of what we do and some of our sort of beliefs.
Okay, okay. I mean, I think also what's so worrying is because Ket is such a cheap drug to buy and the consequences can kick in so quickly. Um, Please concur that I'm saying it correctly, but like if using every single day for 3 months, then you can have ketamine bladder with irreversible damage, which is the experience that we experienced. And that has lifetime consequences. This is why we're interested in the conservative treatment, to help actually reduce some of those symptoms. Obviously, it's important that they are abstaining. Can you possibly share some of the symptoms that you experienced with regards to physical symptoms whilst using the KET? I think Finn has just gone on frozen for a minute. So I am going to go to Caroline, and then we'll come back to Finn when he is back. Oh, he is
Oh,
back with us
yeah.
already. No worries. That was good. So yes, I was going to say, could you explain some of the physical symptoms that you experienced whilst using KET?
Yeah. So for me, the first one was the cat bladder. Now back then I didn't have a clue what it were. It's really hard to try and explain to someone the level of pain that causes, because it's not. I've never had pain in my bladder up to taking care. You know, you might need a wee in it. You can feel, you know, you need a wee, but that level of pain in that specific area, it's not something that you'd experience on a day to day. You know, there's nothing to compare it to. And the way I compare the cat bladder, some people don't like me terminology here, but it, you know, and I just think it's quite a powerful way to do it, but it's also realistic. If you imagine taking a knife and eating it up, you know, with a blowtorch, and just sticking it in your bladder and just turning it, that's the best way I could describe it. Someone described it as having, you know, excuse me, having boiling hot water poured into it. It's that kind of pain, and it's just absolute burning and stinging, and yeah, it's excruciating. And they were the first things for me, really. Some people get cat cramps before anything, which is more like, I believe it's like your stomach, more spasms and spasms in your bladder. But for me, it was straight into you know, the sort of the bladder. I don't know what were going on internally. Obviously, I do now, but back then didn't have a clue. That was the first thing, and that carried on for a little period of time. And then next after that came the blood in my urine. Now, again, back then there was no education, no awareness, so I didn't have the slightest idea what was going on. That then progressed, then there was jelly in my urine, which I now know is the gag layer of my bladder, which I've literally burnt, you know, with the ketamine. It's absolutely corroded and coming out in my urine. Um, then there's the kidney, you know, pains in your kidneys and like just into all your internal organs. You get shooting pains all over, and that's your organs crying out. They're saying, "Look, we can't take this. Stop what you're doing," type of thing. Um, Stomach ulcers. I had stomach ulcers for a period of time. Now that was partly because of the ketamine, but partly because of the painkillers I was taking. You know, so that's sort of. I couldn't say. I do know people that have had them as well, but again, they've been on painkillers too. So you can't really say would ket that do that alone. I believe it would, but I couldn't tell you as a fact, so I wouldn't want to say that. But I do think it would. Um, honestly, the effects, there's so many to sort of list. And some of them become normal, even waking up with headaches constantly, being bunged up, issues with my nose. My nose to this day, when I breathe through my nose, it whistles, and I struggle breathing through it, and it's kind of sort of bent one way. It's kind of collapsed to one side. That's the nose stuff. The brain, there's the effects, sort of, especially in younger people, the effects emotionally. So when I see 13-year-olds and stuff taking it, you think they're underdeveloped emotionally, physically, mentally. They're taking this amount, or no matter what amount it is, if they're taking a mind-altering substance, they're stumping development, aren't they? So I've sort of was taking it 17, 18, ketamine, things as well before that. So there's that aspect as well. What's it done in terms of growth, and there's so many that I could go on with. There's things that I've forgot about that I've had, little things, little details that happened, and you kind of forget because of the bigger picture, the bigger symptoms. There are a few. They're the main ones, I'd say, though, what
Yeah.
I experience and what a lot of other people do. But the pain, genuinely, you cannot put it into words.
And that's what's so difficult when you're withdrawing, isn't it? Because that is just doesn't release at all. So I've seen now within some of your online group that some people require surgery, and so that's life-altering surgery, and they still experience dire frequency and still have a lot of pelvic pain, rectal prolapse, and other difficulties there. Even exertion and using energy can then tighten things up and create more pain again. How have you noticed for you, symptom-wise, post giving up?
So, to be completely honest, I'm going to say the first 6 months of me getting clean and sober, and excuse me, sorry, my diet was good. I was drinking water, I didn't really drink caffeine. I was quite on point with what I needed to do. Not perfect by any stretch of the imagination, but I was quite on point. And I got to about the 6 month mark, and obviously I was still under urology. I'd had the camera, and was sort of thinking, right, what treatment is there? I didn't really know much. I know a lad that had this treatment, and he said he's helped him a little bit. Now, again, we got to probably 6 months, and I'm still going to the toilet, and I'm still in pain. If I drink or eat certain things that you wouldn't even expect, random things, I'd be in pain, and there'd still be little bits of blood every now and then. It was nothing like it were, tiny bits of jelly, and we're talking minute amounts, nothing that worried me. And I still struggled, to be honest. There was still nights where I'd struggle sleeping because of pain, or and I was still taking amitriptyline and painkillers, as and when I needed them, which was quite often. And it got quite annoying, and it was like, we're impatient, I'm a drug addict. I'm impatient. I want everything yesterday. So I've done 6 months, I've put all this work in, but I'm still in pain, and it's like frustrating. Luckily for me, at about the 7 month mark, they got back to me from urology and NHS, and they offered me this treatment. I struggle saying it, but it's something like Ilurafil or Ilurafil. Can't say the name of it. Basically, what it is, it's a liquid that they pump into your bladder. Now, long story short, I had the first one, didn't really see much. I had the second one, and my life changed. I think I've had four of them now, and it's absolutely changed my life. I don't experience bladder pain anymore. Don't get me wrong, if I drink a little bit too much liquid, I'll go to the toilet more than a normal person. But on a good day, I can not go to the toilet for 4 hours.
Do you know how much you're able to hold within your bladder now?
And do you know what? I had the camera, but they never measured how it were then or what it is now. But I'd imagine, I wouldn't say I'm at a normal person's rate, but I wouldn't say I'm far behind. And going back, 15, 16, 17 months ago, whatever, I was literally running to the toilet every 10 minutes, 20 minutes, like people are, going in a car journey, stopping and going bottles and bushes and all kinds of stuff that really kind of strip your dignity. Um, you know, they do. It's quite sort of, yeah. And
Yeah,
now I can pretty much live a normal life, and a lot, you know, it's important for people to hear that because it gives them that hope that things do get better.
yeah, yeah. Because typically I'm hearing that people, when they've got ketamine bladder, are holding between 30 and 50 mils, which is very tiny amount. Um, you would like to think that most bladders can hold 400 plus a little bit more maybe, but yeah, so 30 to 50 mils, and I've seen within your group how, you know, that's still ongoing, and the pain and the painkillers they are, and the surgeries that are required. Thank you so much for that, Finn, because that's given us an insight of the pain that's involved and the experience. Caroline, when you're working within your rehab centre that you visit once a week, what kind of symptoms are you noticing with who you're working with?
So what I've noticed over the last sort of 6 months is the amount of younger people coming through. So that was what made me sort of think what's going on here, just generally, and because I hadn't known about ketamine bladder then. So there was younger people coming through, and then I had a couple of people in class, and there was one young lady who was literally in a pretty much in a nappy. And I was like, what's, you know, what? She was like, oh, I can't jump around, I can't do this, I can't do that. And I was like, well, why? And so she explained what was going on and how much pain and that sort of stuff that she was in then. And just like Finn was saying, you know, like how that it was the pain that really made me think, oh, that's this is awful sort of thing. And yeah, got my interest peaked in what was going on. And I just wondered, obviously, because I'm frontline at only 1 hour a week, but if there was something that we could do with our knowledge to help. And that's why I sort of reached out to you guys. Really, the pain is the main thing, and people literally going out of class every 2 minutes and not being confident to do any sort of exercise. So, and obviously listening to Finn there, I can totally understand why now, if they're in that much pain and not being able to hold any amounts, and they're not going to be wanting to exercise at the early stage that they're at anyway.
And they're not then,
Them.
you know, to enjoy the benefits of giving up on that physical,
No.
because they're constantly living. And I
Yeah.
think what was really concerning for me was when I was speaking to the ex-users with regards to the vulvodynia and the prolapses, and dealing with their surgical bags and etc., and also just not knowing where to go to get any help. And so I think, Michelle, this is where you come in, my lovely. Being a specialist pelvic health physio, I appreciate both of you for the time that you have given, and the input you've offered in exploring different possibilities of conservative treatment that we know work really well for the general population, as well as holistic therapy. But I think you're best placed to actually now discuss some of the things that you've come up with and we've discussed between us. So, Michelle, over to you, my darling.
Thanks, Louise. I'm so grateful to be doing this. If anyone hasn't already watched it, the BBC iPlayer has got the ketamine program. I'd highly recommend it. It really sets the scene and shows just how big a problem this is, and how actually detrimental it is to people's lives. And if all we can do today is get out there, everyone talks about this and tells one other person about it, we've been successful. But as far as a healthcare professional goes, Louise and I were talking about this and thought, hold on a minute, this isn't a question we ever ask about recreational drugs. It's kind of very much a taboo subject, isn't it? Obviously, when you see that documentary, you'll see that the use of ketamine since 2022 has gone up by 238% in the UK. It's dirt cheap, as you explained, and it's shocking what young ages it's been accessible to. And then as far as a healthcare professional goes, we have the wonderful British Association of Urologists Surgeons recommendations, and that's what's helped Finn so far. So he's managed to get some bladder installations that really helped him with his pain. But where Caroline, Louise and I are passionate is lots of people in the world have got chronic problems with the bladder or bowel, and it's so important they get medical intervention, but they also really need holistic intervention. And we're really passionate that the people we see, the powerful effect it has, doing simple things like going through breathing techniques with them, teaching them things like restorative yoga, because you really need to get to know these people. And one of the main reasons people take ketamine is because maybe something's missing in their life, they're feeling a bit low, a bit anxious, or just that innocently they just wanted to make their evening better on a night out, etc. So if we can help with how they manage their ongoing anxiety when they come off the ketamine or previous low mood, with encouraging them to go for daily walks, improving how they're eating, looking at their hydration. We know with any cystitis patients that we get, and obviously one of the big symptoms from ketamine is the cystitis type symptoms, that one of the things I see clinically all the time is once people come to see you and you go through their pelvic floor and check actually whether it's weak, whether it's hypertonic, etc. And what I mean by that is some people, when they've had trauma around their pelvic organs, lose the ability to contract and relax normally, to function normally, because literally they're holding the trauma in their bodies. And when you examine the pelvic floor, male or female, and highlight to them that they're literally not in a low resting state, using things like breath work and explaining to them the power of the vagus nerve and all the lovely things you can do that don't cost anything. They're holistic, have been around for thousands of years, and something they can use as a tool every day, can very quickly help them relax that pelvic floor so it fully lengthens, and then they can contract it, and then they can develop strength. And then once they've got a good strength for that pelvic floor, they can also learn how to use it dynamically and cope better with those urgent symptoms, the desire to keep urinating, and have the confidence to believe in themselves that they can put it off a bit longer. So I think that's where we're quite passionate. Is it's wonderful they're getting really good comprehensive investigations currently and pain relief, but please can we start adding to that something more holistic, like we do with every other pain patient that's out there in the world. Teach them pain education so they're not terrified of the pain flares. Help them understand they will have a flare up if they're doing too little, doing too much, or if they're just run down. So what else can we help them to keep their immune system up? Exercise, getting outdoors, going for walks, trying to socialize, things they may be actually refraining from because of the debilitating symptoms they get from this problem. So I hope that kind of, Louise, is the sort of stuff you were hoping I can mention, because that's where health professionals like myself, and also fitness professionals that really take their job seriously and want to go the extra mile, are perfect for these kind of people, to try and do more than just get them out of pain, but just get them a good quality of life again, and then cope better with the future.
Yeah, absolutely. Within your role as a specialist pelvic health physio, what are some of the practices that can be put into place by your field?
So you can try TTNS or PTNS. So for some people, if they literally feel like they can't stop urinating, you can try and calm the bladder down. And that's something you can buy a TENS machine for £25 and place 2 pads on the ankle, do that for 30 minutes, 3 times a week. And there's good evidence to show that can help calm the bladder down. There's also PTNS, which is a needle version of that, and that can be accessible on the NHS. But at the moment, ketamine bladder doesn't necessarily come under that pathway. It's more of an overactive bladder that people get sent for that. But we also know about TENS electrical stimulation as well for calming down urgency and overactive bladders. Just little things like teaching someone when they feel urgent with urine, try some breath work. See if that alone will calm the bladder. Try do some heel raises. Does that make any difference? It's all about distracting that nerve and focusing on the feet, and then that gives them the ability to now just walk calmly to the toilet and not have an accident. And equally, I think sometimes I can't believe how powerful going through breath work is with patients that have lived with pain for years, have had multiple surgeries, and it still hasn't changed their pain. And then you go through breath work and letting go of the pelvic floor and down training the pelvic floor so it can function better. And they literally are blown away with how quickly that works, something so conservative, so straightforward. So there are lots of things like educating people on, like Finn mentioned, their diet, what they're drinking, the just education. If you think about how young a lot of these people are, they may be on energy drinks, they may be drinking, Coke, Fanta, because that's what you do at that age, isn't it? They could be the things that are making all the difference between keeping that bladder calm and being able to not urinate as much. A simple tip like sipping water rather than gulping water, you have 6 times less urine output. So if you're someone that can't stop peeing, just that little tip could make a big difference.
Yeah, and I'm thinking as well within the holistic therapy, again, the stretching and really giving some length and relaxation to the surrounding areas. Can I then ask what about manual therapy? Because we
Yes,
know that there's some scar tissue going on and there's going to
yes.
be stiffness around the organs. So again,
Absolutely. Yeah, so I did my master's dissertation on interstitial cystitis, which a similar kind of group in some ways. Obviously, sometimes it can be without infection, and these people don't have an infection. And what the studies found for that is, like, over 85% of people with interstitial cystitis, which don't have an infection, which people with ketamine bladder don't have an infection, they actually had myofascial trigger points in their pelvic floor, so areas of pain. And when they had the manual therapy done on the pelvic floor, they had big improvements in their pain. So it's well worth looking into that in this target market to see, are they also having pelvic floor myofascial trigger points, and could there be we know that there's nerve inflammation going on in this patient clientele. So being able to reduce that inflammation, whether that be through manual therapy of the pelvic floor, and also the wonderful visceral mobilization. So abdominal pain, which obviously Finn mentioned, that this is a really good technique that's well known around the world. And I've heard patients with endometriosis tell me how powerful it's been for them. So again, could that be tried on some of these patients to see, by having a deep massage in your abdomen and actually massaging around the organs, can that improve, blood flow? Can it improve the nerve conduction? Can it improve lymphatic drainage? All these little things that are usually really helpful with people with chronic pain and pelvic pain.
yeah, I think it would be so good to explore this avenue and to encourage exploration,
Yeah.
just to see if it's positive, because I really believe it could be. It could be. We need to explore further.
Even acupuncture, that's another wonderful modality out there that's really good for overactive bladders and urgency. And it's all about, I think, giving these people choices so they can have an informed decision of what they actually want, what appeals to them, what's realistic for them, and giving them a broad choice of treatment options.
That's wonderful. We're keeping it brief today, but this I feel is just really important. And I just want to thank all of you for collaborating on this, because I'm going to be sharing this not just on YouTube, but it'll be on our website, on the men's and women's advice sections. And I implore anybody to share the video to other health professionals or to people that are supporting this group of people that actually really need your support and help to get them with the best outcome possible so they can move forward within their life. So thank you so much. We will be having a supporting PDF as well, which you can obtain by contacting adoreyourpelvicfloor.co.uk on our website on the inquiry form. I can send that out to you. And let's keep talking and keeping exploring. And thank you very much, everyone. I really appreciate it.
Thank you, Louise. Thanks, Caroline and Finn.